Erica?
Yes, we can begin.
Okay, so let me start. Said hi to most of you this morning, but again,
Sorry about that.
so I'd like to start. It's the Blue Ribbon Committee for People with Disabilities meeting for November 18th. And I'd like to start by first going to reviewing and approving of the minutes of October 21st. I don't know if you all have had time to look at those and see if there's any. Can I ask for a motion to approve the minutes for the last meeting that we had? Okay, thank you. Can someone second that, please? I need someone to second.
I think Jackie's second, but she's on mute. Jackie, you're on mute.
Okay, I second to
Thank
approve
you,
the
Jack.
minutes.
Thank you, Jackie. We were wondering why you were talking to yourself. Thank you. So do we have, the next item is public comments. I don't know if anyone signed up. Erica or Andrea, does anyone know?
No public comments, Mr. Chair.
So does any of the members of the group have public comment to make?
No.
Okay. So let me go on to the fourth item, which is discussion possible action report from Ora Garcia Special Needs Program. Ms. Garcia, thank God you've been there for us the last several months, or else what would we be doing? So thank you so much for taking the time and being here.
No, thank you everybody for this wonderful coalition. Without your help and advocacy for our community, this wouldn't be possible. You're a voice to them. So thank you so much. And even though the pandemic is kind of not letting us have outreach, so we've been active. For the month of October, we did we partnered with the two of our local cancer support groups, and we were able to provide the health care package that our program is providing to the families. So they did like a little trick or treat drive through, and we were able, of course, the kids received their goodies from their support groups, but we were able to provide that health cap package for them. And also, we partner with two schools. We're also providing the health package to the special education unit. Right now that the kids are going to school, they requested that support from the program, and we were able to provide that also. And last meeting, we had mentioned that the emergency preparedness isolation receive the physical booklets. They're already out for printing. As soon as we get them out, we will let our partners know, so that way we can start disseminating them to our families. But we have been letting them know, and also providing education on how they can isolate in case they're COVID positive, or in case one of their family members turns COVID positive. So we've been providing all of the resources available for the community. That way they can know what to do a little bit, and also so that way they're not all lost. And with that, since we knew we were going to start with flu season, and again COVID also, during the month of October, I don't know if you've been seeing our social media, we have that way they can help within their stress. So they're fun activities that the parents can do with them at home. We posted those on October, and for the month of this month, we're doing therapeutic gardening. So we're gonna show the families how they can do a therapeutic garden. Right now that they're gonna be on the holidays, and some things that they can use to ease their anxiety and stress as well. But basically, it's those are the activities that we have been doing. And again, thank you for all the work that you've done, that you do every day, and for the great work that you do.
I think it's the other way around. Thank you all. Thank you for your group for helping out. Let me ask.
Yes, we worked. I'm sorry.
Go ahead. I was just curious what specifically what kind of items or information is contained in that booklet or pamphlet that you all are producing.
Okay, so during it was the month of October, I believe, or at the end of it was at the beginning of October. Our program with our people from Austin, and one of the main topics was emergency preparedness. Yes, we do educate the community on emergency preparedness, but they saw that with this pandemic, there was nothing available for people with disabilities. And sign language, every aspect. So they kind of told us that we needed to create. So right away, after we had that conference, we talked to our director, and he was very supportive on us to create that. So we partnered up with our emergency preparedness program here at the health department, and with fire also. So we plan for emergency preparedness. Was going to come around, and getting all the information from like the summer that we kind of started to get all these questions from the families, like, what do I do? My kid has autism. He's used to outside activities, but I'm positive I can't take him outside. So we kind of came up with a plan for them. And it was that's basically the isolation plan for the emergency. In that little plan, we have activities that they can do at home, places that they can call in case they need, let's say, mental health support for their families, and all that information. So it's a start line, but we created something like that with fire and with our emergency preparedness program here at the health department.
That's good. That helps a lot, because I know that they typically have a program to go to, like a rehab program or rehabilitation program that provides an outlet and a time of respite for the family, right? Because they're like with them all day. So right now, it's typically, it must be incredibly difficult for those families that don't have a program to send their kids to, or even adults, and they're having to have them at home, and so consequently, they're having to stay with them. Or how do you keep them entertained and busy? That's the challenge when you even have programs. Yeah, I can imagine when you don't have anything to rely on or anyone else to rely on to help them. So that's a big challenge, and I'm sure those families are going through some really difficult moments keeping their family members busy and occupied and entertained enough so that
Yes.
stress level and anxiety don't accelerate, don't get higher. So yeah, your program, it helps a lot. Your advice, rather. So thank you for doing that.
Thank you. Thank you.
Marta, please answer part one. Marta, part one.
So basically, that's our report for the month. That what we have been doing in our program.
So thank you so much. Thank you for sharing that with us. Oh, let me go on to the second part of that question, that item. It says review and update on services for people with disabilities and any other new or additional services as a result of the response to the COVID-19 pandemic. So I don't know if any of the other members have anything to share that with regard to their population that they serve and any kinds of other services or programs that have been initiated to try to address the pandemic and individuals with disabilities within their own programs.
If I can provide a quick update on what the health department is doing currently, I know Oda provided an excellent summary on our efforts through our special needs programs. We understand that children in our community with disabilities are more susceptible. We need to make sure that they're protected, that they have the appropriate resources and information so that they know how to manage that within their households. And the key here is prevention. Because of we are right smack, into flu season. The City of Laredo Health Department has committed free influenza vaccine through several drive-through clinics. We actually have one tomorrow here at our Cedar Clinic through the Maryland Street or Avenue side. It'll be 9 to 12. You don't have to get out of your vehicle, and you get a free centralized testing for COVID. We do have testing here at our facility, but there are also sites available through a partnership with a private vendor. I forget their name, it escapes me at the moment, but they are situated in strategic areas of our city at the parks. I know there's one in Independence Hills. I know that because that's right outside my house. But there's, I believe, 4 other sites, and we're working to identify additional sites for testing. This is the oral swab. So those people that go to the parks to get tested, they do it on their own through an oral, not the nose test. So that's another thing. Increasing our capacity for testing does provide the community with more accurate vision of where we stand in terms of COVID in our community. And that, we are seeing, and I know we briefly mentioned it before the meeting started, we are seeing that uptick of cases. Part of that is because of the increased capacity in testing, but that really opens our eyes to, especially with the holidays coming up, that we need to exercise those additional safety measures to ensure that we're protected and that our family's protected.
Thank you. So if you go to the health department website, does it give you a list of the locations where and the dates when the testing will occur?
Testing is daily. So everything's being centralized through the City of Laredo website, so you're able to find the information there. And I believe we do have a connection through our website as well. Let me see if I can pull it up.
So, Erica, are you all doing testing there at the clinic every day?
Yes.
Okay. It's good to know. And just, just for entertainment reasons, I'm going to share this with you. One of my kids went to one of those emergency clinics, on McPherson, and we got a bill for $9,000. Okay. So I had an opportunity to speak to Dr. Gonzalez a few days ago, and he was telling me that that's not uncommon. Okay, there's people who are receiving bills for 3,000 and 6,000, and so they, the insurance kicked in and eventually covered it. But what I'm saying is that initially they'll throw a number at you and see if it sticks, okay, and see if they get you into enough panic where you start making payments. And but apparently the billing department is in Houston, and they have the representatives here, right? So the Houston lady tells my wife, well, no, she's overwhelmed and she overbilled. But my wife was like, you're charging me like $7,000 for blood work? What blood work are you all talking about? And so, well, we tested for other things besides COVID. Just we never authorized you to do that. But just to give you, just let you know that if you can go to a clinic or a location that's offering free testing as opposed to charging $10,000.
Martha, please call 226. Martha, please
That's
call 226.
unfortunate. We work under the premise that all businesses are going to work in an ethical manner. But we do see it, and it's unfortunate, and this is nationwide, where they find those loopholes and they're able to maybe assess charges aside from COVID. COVID testing is free. We try to keep up to date with the information through the private agencies that are offering it. We do have a listing on our website, but like I said, now working with this decentralized testing to facilitate it, we definitely that's one of our responsibilities, is to make sure that it's accessible to our community. So it's been free here at the health department, and it should be free at the sites at the different parks.
Erica, and the testing at the health department, is that all day, or is you all have specific hours?
They do take walk-ins, but they do prefer an appointment. So the appointments are handled through our telephone number, 795-4932, and you're able to coordinate an appointment there. The reason they prefer the appointment is so that they have all the documentation and the testing kit ready for you. But the walk-ins, I believe, are 8 to 4.
Okay, thank you.
Mm-hmm.
Good information to know, because when we got the $9,000 bill, I was like, where did you go? What did you do? And you're like, why didn't you go to tell me do it?
System is.
Huh?
I mean, I could share a personal anecdote. I recently got my bill. My baby was in the NICU for 44 days.
Oh.
And he's $1 million baby. That's before insurance kicked in, we were very close to that $1 million mark. So
wow, my God,
it's insane to see those numbers. So I do understand the shock of getting a bill and seeing those 0,000. But it's healthcare in America. It's insane, and thank God, we do have insurance. But I think that's another reason why I truly believe in our mission here at the health department, that we want access to care for everybody, and understanding the current situation, especially now with the pandemic, and again, the economic impact, knowing that people have lost their jobs or have lost coverage. We want to make sure we're that safety net for people to continue to receive care.
Yeah, thank you. Yeah, that helps. And the information that you shared also helps. And yeah, but just I didn't mean to throw us off track. I just think that it's important that people know where to seek out the free testing as opposed to going to a private location or hospital or clinic, because you never know what kind of bill you're going to get.
If I can add to that just for a second, I just spoke to someone yesterday. I do contact tracing in the evenings and with the rural areas around Laredo. And I spoke to a man who, when I called him up, I thought maybe he was running. And he is in the hospital at Mercy Hospital. And the reason he's at the hospital is because he did not have the money to pay for the testing. So he waited until his paycheck came in, a total of 11 days. And right now he's on a respirator and ventilator, and he says, only by the grace of God am I alive. So I'm very happy that the city of Laredo has taken that initiative, because your rural communities are having to wait and people are dying because of that. And
Delia, part one.
it really is overwhelming to see that people have to wait to get to, because they don't have any other place to go. Some people don't have transportation. So I'm proud of our city of Laredo.
And feel free to reach out when you do have situations where you become aware of people in our community that require additional resources. Feel free to reach out, a quick text or email to me, and we can go ahead and connect them to a caseworker here at the health department, or I'm able to provide information, whether it's free testing, whether assistance for them. So we could definitely try to connect with the county to see what services can be extended. But anytime, I'm available to you. Any questions you have, if I don't know the answer, I'll find someone who does. So
Thank you.
I do see Mr. Chamberlain has joined us, so we can go ahead and say hello. Hi.
Hi.
Good morning.
Hello.
Good morning.
Good morning to everyone. I apologize for being extremely tardy. As you all are very much aware, right now, our numbers are trending or meteorically rising right now in the community, which is something that we are all collaborating right now amongst our stakeholders call that just ended to be able to mitigate as much as possible and bend this upward trajectory that we are experiencing right now, which is also placing a significant stress on our healthcare providers and our hospital system. As you all very much know, Laredo is a medical hub for the surrounding counties in these rural areas that were being discussed right now, Zapata, Jimhog, Duval, La Salle. So we need to make sure that we are very much prepared and we've basically tripled our hospital census. It has doubled. That hasn't tripled, but it's doubled. Our case counts have tripled. So we are very much concerned. We are making recommendations for everyone across the community that less is more this Thanksgiving, this COVID Thanksgiving, with less interaction, with less guests, if not any guests, will be less risk for you, your family, your friends, and of course, the community at large to prevent any further transmission or contracting COVID-19. As mentioned last week, sorry that I'm just jumping in randomly here. I apologize, just to share a little bit of info.
And you had perfect timing. There were some questions on COVID. I did provide information on our flu vaccine drives, on our testing sites. But of course, you're the expert, and I know Mr. Castillo, he's the person to ask. I know you had some follow-up questions, but he'll be able to provide the information needed.
No, you provided all the responses I needed. No, I was just telling them that some of the private testing clinics are just really trying to stomp the public, okay? And I was telling them about my experience with a $9,000 bill that I got from one of my kids going to one of the clinics. And it took several weeks to fix that. But in the meantime, they're telling you, well, that's what you owe us. And paid. It's like, no, we're not going to do that. And so I'm telling the group that it's really important that they seek out the free testing that the city provides as opposed to the private entities.
Is a very unfortunate situation. And then there are those who are not as defiant as you are and who basically just succumb to the payment. And that is not something that we want anybody, especially who are in a difficult socioeconomic portion or status of their life, to have to pay a $9,000 bill. So we are absolutely fortunate. We are blessed to have this service here in the city of Laredo that is providing free COVID-19 testing at these 4 locations. Currently, I can share that our first week we did have 4,000, which was November 2nd to November 6th. We did have 4,000 tests that were performed. This past week, we had 8,300 tests that were performed with these 4 sites. We will be expanding to 4 more locations. I can share those with you now. Those 4 locations will be at the Fire Administration building on McPherson. The 3rd will be at Slaughter Park in District 3, and the 4th will be in District 4 at the Fire Station number 5 on Bartlett. So now we will have accessible testing in every district of the city that will be 100% free. You can definitely just walk up. I've use. Of course, you might find yourself in a socially distant line, but if you do register before, you will bypass that line and you will go straight to testing. So I do recommend setting up those appointments. It's very convenient and easy to do it online. But if you don't have that accessibility to broadband or a mobile device, then definitely just walking up there or that a mobile device that does not have internet connection. Result. If not, it'll be an email with your result. So it is very convenient. These turnaround times are generally on the max 48, but the majority are in the 20. They put the result into the palm of your hand. So if anybody needed those results, and if anybody needs to get tested daily or every Tuesday and Wednesday or every Thursday, absolutely, that is something that we are advocating for over these next couple of months. As unfortunately, I can be honest with the group right now, it's going to get worse before it gets better. And that's not a position that we did want to be in. But unfortunately, that's the reality of this situation. There's been a lot of relaxation and COVID fatigue that has been experienced in the community, and very much so. We understand that this has been ongoing locally since March, and people are tired, but we're in the last stretch right now. We have the light. We see the light. There are 2 new vaccines that are 90% effective or greater into our community. So we just need to stay strong for these last couple of months and know that we will be able to have infectious diseases that are communicable can come back from influenza to another coronavirus, but we do need to be vigilant, and we will have a new normal with making sure that we do want to prevent infectious disease and making sure just to keep people at home when they are sick to prevent others from getting sick when they're within the work environment. So I can probably talk for another hour. I will pause here for any questions. And I mean, we're here for you here at Health. As Erica mentioned just a short while ago, we're a text message, email, or phone call away. We are your chief. And definitely will help get anybody to the service that they do need.
Thank you. Thank you for the information. It's real not informative. It's really important. It's critical, especially right now when things are seems like we were doing so well, and all of a sudden it got worse, as everyone had predicted it would become worse. And so we're there. So let me ask you something, Richard, regarding the locations that you mentioned. Are those areas open from 8 to 4? You had said, Erica. Are those permanent? They're there all the time?
They will be permanent. They will be Sunday through Saturday. So every day of the week, they will be open from 8 to 6. So we wanted to make sure that if you work early or if you work during the week, that you still have time to be able to gain access to testing, that it wasn't just going to be 8 to 4 Monday through Friday and therefore exclude anybody that was during their working days or et cetera, that we do have that accessibility 7 days a week, 9 to 6.
Sounds good. Anyone else have any other questions or issues?
Yes, I have a question. Can you hear me?
Yes, absolutely, Ms.
Yes, ma'am.
Representative.
Okay, the first question that I had was in regards to vaccine administration. Does the city of Laredo have a plan to prioritize certain groups? That's number one. Number two has to do with gatherings for Thanksgiving and drive-by birthday parties for children. Are there regulations put forth by the city in regards to those two things? So starting with plan for vaccination, Mr. Chamberlain, does the city of Laredo have a plan for what groups will be administered the vaccine first?
Those are great questions, Dr. Rosinger. So definitely to tackle the first one, the city of Laredo will be following the state of Texas and their plan for dissemination. We are receiving our vaccines based on a select panel that has allocated these vaccines for members of our community. So we have been told that these will be for first responders, for healthcare frontline workers, and for our most vulnerable populations, which is i.e. our nursing home residents. As mentioned, though, with the Pfizer vaccine, 7.5 million dosages will be ready by the end of will be in production and be ready for December. But that's 7.5 million dosages worldwide, which you divide that by 2, so that gives us 3.5 million individuals worldwide that will gain access to those vaccines. So here in the United States, we have not gotten a specific amount of what is going to be allocated to us and how many dosages we will gain. And then also Moderna has not put out their official number of vaccines that will be produced by the end of December of 2020, but for 2021.
Mr. Chamberlain, my question would be, if we're looking at receiving the Pfizer first, the deal with the Pfizer is it's kind of like for people up north, because as I understand it, you need it in order to even have it be viable, you have to keep it in practically sub-zero temperatures. Mm-hmm. Otherwise, it's not going to work because it's not going to be any good. I was more interested in seeing maybe the Moderna, because the Moderna doesn't have that type of criteria for keeping the vaccine viable.
And unfortunately, we are at the mercy of the system to see if we obtain the Moderna or we obtain the Pfizer. But know that Laredo Health is capable of hosting and holding on to both. And we are approved as a COVID-19 provider already for the community. So whether we get...
So we have the refrigerating, the freezers or whatever is required for the vaccines for if we receive the Pfizer?
Yes, we have those here at Laredo Health. We have the capability of hosting them at -70 degrees, which gives them the shelf life of 6 months. For the Pfizer.
In terms of the operations, we are doing everything that's needed so that we're ready to, like Richard says, host the vaccine, make sure we have the appropriate equipment, the appropriate procedures. So we're keeping abreast of any updates and to be as ready as we can be.
And there's a new terminology known as micro-planning that we are partaking in here at Laredo Health, as you can only open these refrigerators 2 times a day. And that once you do remove vaccines, you have a certain amount of time. So if we are going to remove a vaccine vial that is for 5 dosages, we know that we have to administer that vial within 1 hour. So we have to have basically a very strict plan and protocol to not have any wastes associated with this very valuable vaccine for our community, and know that our team is 100% on board with with the information that is being provided to us by the Texas Department of State Health Services. and we are very much waiting for their response as to how many vaccines will be allocated to Laredo Health, and then of course in specific to how they want us to use them. So even though we would like to say, yes, we want to take them to, this facility, we are not going to be able to say we want to use them at this facility. The state will tell us where they're going and for whom they're going to be used.
So you're saying that, just to review, the first responders, medical personnel are the ones that are going to take top priority, followed by elderly and nursing homes. Any idea, third group?
So that will be the priority, of course, and that will be pushed over into Q1 of next year. They are looking at mass vaccinations in the millions by Q3 of 2021.
Now, the next question had to do with, we're looking at a spike. Of course, there's a lot of variables, and maybe because we're doing so much testing here in town, but we're seeing a spike in cases. So my question is, we're looking at family gatherings. We're looking at Thanksgiving coming up. We're also, I've been seeing a lot more drive-by birthday celebrations. So my question is this, does the City of Laredo Health Department have parameters or regulations in regards to how many people, et cetera?
As of Monday, this past Monday at City Council, that was one of the resolutions that was accepted by Council, to where at households, as of Monday, you are no longer able to have more than 10 individuals, of course, including your family. So if you do have a family of 10 and you're inviting 10 over, that is completely fine by the rule. But as of now, we've been sharing on our press or on our media briefs for the past week, last week and this week, we do not advise of hosting a gathering at home. It's going to be very difficult for anybody to ensure the safety of their family and friends. And I can be very honest with this group that at the beginning of the local COVID-19 pandemic, we did have a family, one family who had hosted an event, and they, out of the 42, they had 27 that did come down with COVID-19, and they had 6 fatalities. That was very difficult for that family. And we do not want that to be experienced again over this COVID-19 Thanksgiving, because yes, we have the fatigue, and yes, we yearn for that social interaction, especially with our family and friends. But it's something that we are sharing, do not participate in. And then we did, of course, for those who are going to participate in hosting a COVID-19 Thanksgiving, that you were supposed to quarantine as of the 12th with you and your family, and not be going out and to get routine tested over this 14-day period, to know that you all have made it out of the incubation period, that you all do have negative testing. But that's a big challenge for many people, to quarantine for 14 days just to be able to see your family members or pump gas. Those are still potential areas for exposure. So there is a way to have somewhat had a safe, but of course there's no way to eliminate all risks, because we are as the events that we do host personally are as risky as the most riskiest family or friend that we don't know what they're doing. So it's still our position to advise not to host any gatherings, just for it to be for your immediate family of your household. But as of Monday, City Council did approve that you cannot have more than 10 individuals at your home until the emergency order is suspended, or of course otherwise overruled by council.
Thank you, Mr. Chamberlain. My last question has to do with what I've seen a lot in my neighborhood, which is those drive-by celebrations for children's birthdays. What is the City of Laredo policy in regards to drive-by birthday parties for children?
Specifically for drive-by parties for children, or for anyone who wants to host this type of event, it is an event that does provide less risk for the individuals, since they will be in their own vehicle. They should not be congregating before or after. Of course, we do see, I will use Academy as an example, that all the cars will be parked there at Academy, and that type of congregation in your car waiting for the leader to start it off is okay, since nobody should be out of the cars. Everybody should be waiting in their vehicle as they get started. There is no specific requirement right now, aside for the fact that if there is 100 cars or more, you do need to get permission from the city to be able to help organize and ensure the safety, as we do know that some of these car parades might be running stop signs or backing up through stoplights, which causes issues for traffic and safety for the rest of the community members. But as per, are they allowed? Yes, they are allowed. We do want them to be controlled. If they are over 100, a permit is required, but we do advise for no gathering before or after, and that they remain in their vehicles. And once the parade has concluded, that all actions afterwards are suspended.
We do encourage the person hosting to exercise the measures that we all know: wearing your mask, exercising social distancing. They're the ones that are going to have, some sort of interaction with those people driving by. So they need to make sure, the people that are in those cars still wear their masks. They wear their masks. And like Richard said, the most important, yes, it's a parade. You celebrate, but don't congregate before or after in the household or anywhere else.
Thank you so much, Erica. Mr. Chamberlain, thank you so much.
Absolutely. And forgive
So,
me.
Mr.
I was going to share, I do have another meeting to jump into with the Texas Board of Health officials with our legislator right now shortly. So I can definitely hang out for this last question, Mr. Castillon. And I apologize, as I wish I could have more time with this group, but know that I am always available via email or text and phone calls. Absolutely. If I don't get to the phone calls, I will always get back to them. But you did have a question, Mr. Castillon?
I was going to ask a question with regards to the medication, the vaccine that requires refrigeration at such low temperatures. You said that you have the capability, and that's great. But does that mean, however, that medication or that vaccine can only refrigerate?
This -70 sub-zero temperatures. So there is other healthcare providers, of course, maybe not many, but there will be others in the community that are able to house and store this vaccine. But of course, aside from that, if you do not have the capability for the -70 sub-zero temperatures, you are able to keep it in the equipment that they ship it to us in. So with Pfizer, they will be shipping it to us in a container that has a GPS tracker to be able to identify where it is at all times. And so that container is allowed to be housed for up to 15 days with two changes worth of dry ice. So say for instance, if you are XY provider and you ordered 100 of these COVID vaccines, when you have the capability to place that order, you can have them there at your practice for up to 15 days. So that it still provides the accessibility to others in the community who don't have the equipment for housing them up to the 60 days, up to the 6-month mark with the -70 degree temperature mark. So they will be sending them in a specific container that can house them for up to 15 days with 2 changes worth of dry ice.
I have an additional question real fast. It's a yes and no. Will it be cost-free, or how's this going to work? Because I'm assuming it's a pretty...
From what we were hearing right now, it will be free. There will be no costs incurred for this vaccine. This is a real-life public health emergency event that the vaccines should be, and of course I'm going to have an asterisk right there because we don't know how it will change. They should be absolutely free for the public, for everyone rather.
All right, thank you.
Yeah, so with that, I'm going to say thank you very much to each and every one of you for everything that you do in your respected organizations. Together with better health, with better partnerships, we have better health. So I want to say thanks once again. Let us know of anything that we may be of service for. You have yourself a great and safe afternoon and a safe Thanksgiving. And we look forward to seeing you all in the next upcoming meeting. Thank you.
Thank you, Mr. Chamberlain. Bye-bye. Thank you.
And of course, anything that I cannot answer, I could definitely relay the information back to Richard. But yes, know that we are available any questions or any resources that are needed, please let us know. For those that have access to the chat, I did add the 4 sites available for free COVID testing. Like Richard said, they are available all week, and you can pre-register, but they're also capable of taking walk-ups. I did put in the information of our flu vaccine drive tomorrow here at the health department. And an additional note, we do have mental health support for those experiencing, like Richard said, COVID fatigue, just, issues with stress, with worry, with grief. We are experiencing very big emotions right now with everything we have to handle through this pandemic. So we do have a designated licensed professional counselor that is able to take appointments or speak to individuals going through hardships. And I put in the number there for to reach out. So it's 898-2414. He's available Tuesday through Saturday, 8 to 5 p.m.
Okay, thank you, Erica.
Thank you, Erica.
Yes, of course.
Okay. I guess we can move on. Unless someone has something else, we can move on to any announcements, or we've spoken quite a bit about quite a number of things. So I don't know if anyone has any announcements they'd like to make. I think the last announcements with regard to locations and places of testing is probably very vital and important, critical to us. So thank you, Erica and Mr. Chamberlain, for sharing that information with us. Next item I have is just adjournment, unless someone has something before we depart. In case I don't have an opportunity to tell you all, thank you so much for being here, and have a great Thanksgiving and holiday. I guess I'm just going to share with my family and my dog, so that's good. Okay. The dog's going to get to eat a lot of turkey this year. Anyway, unless someone has something to say, then I would ask somebody to motion for adjournment.
I will move for
One
adjournment.
last housekeeping issue or clarification. Next meeting is scheduled for third Wednesday. That's the 16th of December. Wanted to make sure that the committee wanted to go ahead and meet. I know that in previous years we've been able to gather and celebrate together. Unfortunately, that won't be the case. But let me know if you wanted to keep that meeting or postpone it to the following month.
Well, we'll let you know, but I mean, unless it's very inconvenient, unless everyone's going to be out, but for the moment, let's just jot it down for the 16th, and we'll see how it plays out. Yes.
Okay.
Good enough.
So I had someone move that we adjourned. I would need a second.
Second.
Who was that? Who seconded?
Jaime. Mr.
Jaime. Oh. Jaime. Okay, thank you. Okay, so then we'll see you all next month then. Thank Willie.
God bless you guys. Stay safe.
Thank you, everyone. Thanksgiving. We'll see you soon.
Yeah.
Stay safe.
Okay, thank you.